So, we don't cover coronavirus stuff all the time, but we do have a bunch of viewers who have been, I guess for lack of a better term, critical of the mandates, right, that have been coming out. So I guess there are just a couple of things that we want to know, or maybe to provide assurances to our viewership. First, about the Pfizer vaccine for eligible children ages 5 through 11. We've been seeing, and I really don't know what to trust out there in the news, but information showing that there are dangers associated with the virus, with the vaccine for kids. Is there anything you can tell our viewers to assure them that this vaccine is safe for their eligible children?
So for any vaccine, there's always side effects. There's no doubt about that. However, the side effects of the vaccine pale in comparison with the side effects of the possibility of the disease. In any vaccine that we give our children, measles, for instance, the Samoa had 19 kids died, and there's nothing worse than death. Measles, back in 2019, that's when their immunization rate dropped from 95% down to about 5%. With the coronavirus, the problem is they can spread it. There's Delta variant. The previous coronaviruses were not spread as easily, especially with kids. But this Delta is looking for people that are not vaccinated, people who are vaccinated but the vaccine didn't work on. And we always tell people from the very get-go that roughly about 10% of people who get the vaccine, it doesn't work because, it's produced by man. And, man's not perfect. So there's no vaccines that are 100% going to make people have immunity towards them. So, not so much for the children 5 to 11, although there are some cases like we had in the past couple weeks, past month, where we had 10-year-olds with MIS, and if they didn't get treated, the pretty likely to have that outcome, either death or a cardiac event where they're like not as normal as they can be. But most of the times the problems with the kids is that they can spread it, and most of our local population, they love to kiss the kids, they love to hug the kids, and if the kid's infected, it spreads to them. And so even if they get vaccinated, they still catch it, especially for those that have what they call waning immunity. So they can get severely ill, get hospitalized, and God forbid, sometimes they can even die from the disease. And so the vaccine is not only to protect the kids, but also protect people around them. And that's what we're trying to do. Is the more people that get vaccinated, the less likely that virus could spread, the less likely that virus can rear its ugly head on us.
Dr. Leon Guerrero, out of every 100,000 kids who get this vaccine, how many will die from getting the vaccine?
On the vaccine?
Yes.
Probably zero. At least on Guam, we haven't had anybody die from any of the vaccine, from the COVID vaccine.
I think that's the first concern that people have, or with whatever information is spreading out there, right? That's the first concern. And then the second, I've been seeing something about myocardia something and periocardia. I don't know. I'm guessing this is the heart thing that you were talking about. For every 100,000 kids who get this vaccine, how many will experience symptoms that affect the heart?
Well, okay, so the myocarditis was reported with women, not with the Pfizer.
Okay.
I'm sure there might be some complications with the Pfizer, but most of the cases of myocarditis, and the myocarditis that you get from the vaccine, usually self-limiting, meaning it usually goes away, and it's usually not much other than just chest pains. It usually doesn't cause anything else, no long-term problems. And again, it's usually with the Moderna, with the kids, they're going to get the Pfizer, and there hasn't been that much reported with myocarditis, and then the dose for the kids, just like the flu shot, the dose for the kids is not the same as the adults. It's less.
1/3, right? If I remember correctly. Thank you for assuaging those concerns to our audience. The second thing I wanted to ask is about well, it's a little more global. It's all things considered, the high infection rate, or the basically the surge that we had, the low death rate, the high vaccination rate. There are pros and cons here, right? Have you guys weighed this out, and should we be considering here on Guam a full reopening of the functions of the economy, social life, education? Why or why not?
Okay, so first of all, the vaccination on this island, on our island, is very high. Our problem is that we have a lot of people who have comorbidities. And what that means is we have a lot of people who have heart disease, a lot of people that have diabetes, a lot of people that have high blood pressure. And then the other issue that we have is that we become more and more condensed. I mean, when I was growing up, if you lived in, you were like the kind of bungalows, you lived in the Rito. But you don't all live in one house. You live in an area, so that's like grandma and granddad live in one house, and so the aunts and uncles live in several other houses. We're seeing more and more multi-generational homes, meaning you have grandkids, kids, grandparents all in the house. So it's easier to spread whatever, whether it be COVID or any other, like if the flu, you're going to have that spread so much easier. And that's, I think, the problem is that, and again, that's where the vaccine's going to hopefully help out, is that if you get everybody vaccinated, it's it's a lot harder to spread it. Even though, obviously in a multi-generational home, you got 15 people in a house, that 3-bedroom house, you cannot practice social distancing. And, people don't like to wear a mask at the house. And so realistically, you're going to have more exposure because of that. And so with the vaccine, hopefully what we're going to see is that even though we have more exposure, it's not going to be as bad because most of the people in the household are vaccinated.
So what you're saying is when you insert that variable into it, it's not time to fully reopen? Is that what you're saying?
Oh, no.
Oh, okay.
I'm not saying that.
Okay,
I'm just
okay.
saying with the vaccine, it's going to be, I don't think COVID-19 will ever totally go away. It'll be something like the flu. Every year, it's maybe a different strain. So, that's why we have the flu shot every year. So my guess is that this COVID-19 will never really truly go away, that it'll just, it will increase every once in a while. So that's where we need to get re-vaccinated, and maybe every year, maybe every other year. I don't know yet, because obviously the vaccines only started last year. We don't know all of the ins and outs of this COVID-19 infection as it applies to the vaccines.
So then, then, should we be considering a full reopening then?
What we do is that we make our recommendation, and because they have to look not only at the health issues but also the economic issues. So if we did this with the flu, every time we have a flu outbreak, it's just going to be devastating for the island, because obviously people can't go to work, they can't have people come here as tourists. So the vaccines, the wearing the mask, the physical possible will help alleviate that, so that you have less problems. But there'll never be no problem.
So that's what I'm trying to drill down to is, if this is something that we're accepting as endemic over pandemic, shouldn't we be talking about that now? Shouldn't public health policy be preparing for a full reopening?
I mean, we're always preparing for that. That's why we are, again, pushing for the vaccines. Because, again, the more people that are vaccinated, the less risk it's going to be. When it becomes from pandemic to endemic, I don't think it's going to be right now. But eventually, once more and more people get vaccinated, it's going to be a lot better situation for people.
I know that things are always moving as things change and as the science develops, right? But is there some sort of marker for the percentage of eligible 5 to 11-year-olds to get vaccinated before you guys are able to call it endemic over pandemic?
Okay, so, again, with the, to give you an example, because we have data for it, with the measles, it's roughly 92 to 95% of people on the island are either vaccinated or have immunity from the disease. The risk of spreading it is practically zero. So again, I point out to that what happened in the island of Samoa and American Samoa. Samoa, the vaccination rate went from 95% down to 35%, and they had over 80 kids die. Numerous others were affected and requiring intensive care. Whereas about 150 miles away in American Samoa, which is same ethnic background, same issues with the comorbidities, you only had 2 kids get sick because their immunization rate was 95. And that's just, so at what rate, we don't know enough of this virus to really call what rate the immunization rate would be that we have what they call that community immunity, or what everybody's calling herd immunity. But if you look at the stats, the surge is going down, the hospitalization is going down, the deaths are going down, not zero, but it's going down. And so we have a multitude of therapies. The easy ones are like I said, to wear the mask, but then we have the vaccines, and then we also have the Regeneron, which is the monoclonal antibodies for treatment.
Yes.
So with that armamentarium, it's getting closer to that point where we consider opening up. And it probably won't be opened up in full, but maybe in steps is what I first see is going to happen.
Okay, and then lastly, Doc and Annette, regarding deaths, and I understand that because of privacy issues, not too many things can be revealed, but I think a lot of people want to know, of those who have died of coronavirus-related disease and who were vaccinated, I don't know if there's a better way of putting this, but considering their underlying health conditions, would they likely have died anyway?
Well, the truth is everybody's going to die eventually.
Well, I mean, just would they have? They went to the hospital. Did they go into the hospital because they had a heart attack, and it just so happened that they also had coronavirus, and they died a couple of days later of the heart attack. You know what I'm saying?
Yeah,
as an example.
But then some of that, most of that though, is where they get the COVID-19. They have limited reserves to fight off the vaccine, the virus, so that when they get sick, it throws them over the limit. So yes, they had comorbidities, and eventually they may have died from that. But that virus just tips that over so that instead of dying 10, 15 years from now, they're dying now.
Okay, so then then these coronavirus deaths, coronavirus was a contributing factor to the death.
Nothing's ever 100%, but I think the majority of the deaths, the reason is when you look at the statistics, maybe about 90% of the people that have died are unvaccinated. Whereas those that are vaccinated, if they get sick, then they may require hospitalization. but the death rate is much more unlikely to occur, even though they have the same comorbidities as the people that have died.
Yes, yeah.
So it just shows you that, you know, the infection has increased the risk of the people with the comorbidities dying sooner.
Okay, that makes sense to me. Thank you, Doc. I appreciate your time, and thank you, Annette. Is there anything you'd like to add for our audience?
Kind of, if I could
Sure.
add in about that is one of the reasons why our department asked for the CDC team to come out to further investigate the deaths, especially the ones dead on arrival. So going back to your question, right, about those with comorbidities and not being vaccinated. So that's something, as they get more information and they do their analysis, then we can get a better picture of what's happening on Guam. You know, but like Dr. Bob said, we have multi-generational families condensed into one house. And so that's why on Guam, yes, we have a high vaccination rate, but just because of our culture, like you said, we like to kiss and hug, you know, and gather, that makes us at higher risk. Our comorbidities, add to that risk. And so again, we continue to emphasize the need to be vaccinated. As we learn more about this virus and its constant changing, we're seeing how the effectiveness of the vaccine wasn't as long as we thought, and so that's why all of a sudden you heard there's a need for additional dose for those who are moderately to severely immunocompromised. Then we had the booster dose being recommended, and now we're moving to the younger generation because we're seeing more and more children who could not avail of the vaccine come down with infection. And so going back to the safety concerns, you know, the vaccine manufacturers have their data. CDC looks at have their own data, and they compare it and they look at it, and so, you know, they found out that the benefit of being vaccinated is far outweighs the risk of coming down with infection. And so going back to your question about myocarditis and the pericarditis, there was no children who were in the vaccine trials that came down with those two conditions, versus children who were not vaccinated, who had the infection, they ended up having a higher rate of developing that illness or that condition. So that, you know, again, safety is always of the utmost importance, and that's why we always wait. We wait for FDA to do their debate analysis of the data available. Then we go to CDC and their advisory committee, and we wait for them. We follow their guidelines, and we wait until everything's been approved. And so again, vaccine safety is always the utmost important to any jurisdiction. And we want to protect the youngest from getting these infections, bringing it home, and maybe passing on to family members who can't get the vaccine due to medical condition, or the infants. You know, that's what we've been seeing over the past few months, is a rise in the pediatric population getting the illness. And so now that this vaccine is being made available to the younger generation, the younger population, we encourage parents and guardians, please look up information from verifiable and that's valid information. There's a lot of information out on the web, but is it accurate and is it factual? Please call your doctor and ask those questions. Call public health. And so again, it's all about preventing disease, hospitalization, and death. Because again, we're seeing, and some of the data we've had from colleagues is we've already seen 745 deaths in the U.S., and that was as of October 21st.
745 deaths from, I'm sorry?
From COVID. 745 children have died, and this was as of October 21st.
Okay.
And we've had 6.3 million tests positive for COVID, right? And of that 6.3 million, just slightly over 1.9 million were in that age of 5 to 11. So,
oh, wow.
Again, like Dr. Bob mentioned, we want to prevent death. That's, and if we have a vaccine that can prevent that, or even minimize the symptoms should you have it, by all means, we encourage everyone to please be educated, have your children vaccinated, and if you too haven't been vaccinated, mom or dad, auntie, uncle, please get the vaccine, because like Dr. Bob said, we have to have a high vaccination rate if we want to try and get back to slowly opening up our society, going back to some type of normalcy. Because unfortunately, as we're seeing, our neighbors in the north, Sinamai, they now have an increase in cases the past few weeks, where for how many months they didn't have anything. So again, we always like to say these diseases are playing right away. And look, it's Saipan is dealing with a surge in cases. We've been dealing with a surge, but thankfully it's going down. And we want to continue to see that downward trend. So hopefully something will be a little bit more relaxed during the holidays.
So just to summarize what has come out of this conversation, essentially the vaccine is safe for kids. There is a couple of the variables that we need to consider when we talk about the full reopening of the economy is the high rate of comorbidities, meaning people who have underlying health conditions like diabetes, cancer, heart disease, obesity, etc. The fact that we're a very social people in our family settings, and we have larger extended families, right? That this disease is going to be with us, that it's looking like this disease is just going to be with us, and sort of like the flu and the flu shot, there will be a need to boost immunity from time to time in order to reopen in steps to a full reopening. We need to increase our vaccination rate until a point where we see that this is endemic rather than pandemic. And until we get to that point in public health policy, the therapies that are in place aside from vaccination include wearing your mask, keeping your social distance, washing your hands, etc. Am I capturing that all?
Yes.
Okay.
Thank you. Yes. Yes.
Okay, cool. Thank you. We'll get this out to our audience, and thank you so much for your time, both of you.
Thank you, sir. We appreciate you helping push the word. Thanks, Dr. Bob.
Thank you, Dr. Leon Guerrero. Thank you, Annette.
Okay, thank you.
Have a nice